Hello and welcome back to part 7 of this video series on staying healthy and preventing COVID-19 infection during the current epidemic. In this particular one, we're going to discuss about how people get infected and basics of personal responsibilities to getting rid of this epidemic. So let's look at first how does COVID enters into our body. It is a respiratory virus, and was majority of the cases, 75 to 80% of the cases, it enters through the nose and the mouth through breathing, thus directly affecting the lung tissues. So this, as we discussed in the previous videos, this could happen either through the aerosolized the spread from the air, as well as larger droplets when somebody is coughing or sneezing and direct inhalation of or swallowing of those droplets. The second way of getting infection is through the contaminated fingers by touching any surface that has been contaminated through a person with infection. So these contaminated fingers, if you touch your eyes, nose, mouth, or genitoanal regions, through those mucous membranes, this virus can enter into the body directly and then secondly go to infect the lung tissues. So how does this happen? Why is only two kind of tissues are vulnerable and targeting by the COVID-19? These are the two tissues has a specific receptors called angiotensin converting enzyme 2 surface receptors. So this is the entrance point for COVID-19. The virus get attached to these receptors by different mechanisms. It can then inject its genetic constituents into the cells and start multiplying rapidly. So in fact, the COVID doubles the numbers in every 2.5 days. So it's an exponential growth, can make millions of copies of COVID within a week or so. So that's why the people get sick towards the end of first week of having the disease. So it is important to take precautions to inhalation and swallowing this virus, as well as contaminating the conjunctiva and other mucous membranes through their contaminated fingers. So we'll address that issue of washing hands frequently and using masks to protect themselves in the subsequent video. So about 99% of the case infection occurs through these two most common routes. So what is the goal of prevention? So there are two goals. One is the primary prevention and the secondary prevention. Primary infection has been already affected virtually every country in the globe. So it's now the time to prevent the secondary infection, what you call the community outbreaks. And that is essential because once you get a community outbreaks, it can affect the millions of people in countries like India and the United States. In fact, both countries, it can be predicted to have serious outbreaks by towards the end of April in the range of millions of people getting affected. It will be much, much worse in India, where the rural communities have no access to modern healthcare facilities. Therefore, the elderly will be seriously affected, including large number of deaths. So what are the precautions we can take in addition to what we already mentioned? Under the current conditions, the extreme precaution to safeguard oneself and to prevent the infecting others are paramount. That's a personal responsibility. It's not only the responsibility of the government. It is impossible to know who carries the virus. So you need to treat everybody as somebody who's having the virus until proved otherwise. So keep away from people until this acute period is over. Stay at home. Don't entertain any visitors. And don't visit other people, particularly the elderly and the disabled in different places, because you can carry the infection and infect them. So Unless you invite the person for a very specific purposes, do not let anyone entering your home. There is no reason for anyone to come inside your home. It is your home, your privacy, and your family's safety. So, what are the personal responsibilities as citizens to control COVID-19? It is essential to take personal responsibilities and following the guidelines and safeguard oneself as well as the others. Adhere to the local and health authority guidelines. Basic actions recommended include engage in strict personal hygiene without taking any shortcuts, and keeping the social distance of 6 feet we have addressed. I think it's a misnomer. It can spread even as distance as 30 feet away or 10 meters. And avoiding the crowded places is essential, so as washing hands frequently, especially whenever you go out and come or touch something outside the house. So minimize the travel, wearing face masks in public every time you're going out of the house, and meeting anybody, including the officials, face-to-face situation, and follow the essential hygienic manuals. Those who are not feeling well should stay at home and should not intermingle with others. However, if you don't feel by day 6 or 7, you have to call authorities and get their advice. And the hospital will advise the best option or best action plan you can take to minimize risk to yourself and risk to others. So preventing disseminating of the disease. So considering that everyone is infected, we should continue with our self-quarantine facility at home and provide the option of recovering, observation, and preventing anybody else getting sick from COVID or any other viral disorders during this critical period. Meanwhile, the Department of Health must provide all the frontline workers, especially the healthcare workers, N95 protective masks, at least something similar which is available in Asia. This will markedly minimize the risk of spread of the COVID-19 to these hardworking people who protect yourself. Prevention of viral spread is the goal, and it is million times more cheaper than and effective than treating somebody with the disease. So I emphasize that protecting the healthcare workers, so as the law enforcement officers, are essential. We need to help them by protecting ourselves and not putting others into risk. So these people who work in the front line are the most vulnerable, and they need our help. We must highly value their services and indeed should support them. The government must provide them with all precautionary measures, including N95 face mask. Not doing so is highly unethical. We should take utmost care of them, and they are doing a phenomenal job across the globe. Thank you. The next video is video 8. We will discuss about using face masks and the nature in the frontline workers' exposure. Thank you then.